Hi everyone, and welcome back to Inside Pet Health. Today, we're tackling a topic that every pet owner absolutely needs to understand: essential pet first aid. Knowing what to do in an emergency can be the difference between life and death for your furry friend. While first aid isn't a substitute for professional veterinary care, it can stabilize your pet, alleviate suffering, and buy precious time until you reach the vet. So, let's get prepared. 1. Building your pet first aid kit. First things first, build a dedicated pet first aid kit. Don't wait for an emergency. Here's what you should include: basic first aid supplies, non-stick bandages, gauze pads, adhesive tape, pet specific if possible, antiseptic wipes or solution, like diluted povidone iodine or chlorhexidine. Check with your vet for safe options. Blunt-tipped scissors, tools, tweezers for splinters or ticks, a clean towel or blanket for warmth or restraint, a muzzle. Even the gentlest pet can bite when in pain. Medications, vet-approved. Activated charcoal, only if directed by a vet for certain poisonings. A pet-safe anti-inflammatory, again, only under vet guidance. Saline solution for flushing wounds or eyes. Information: your vet's phone number, emergency vet clinic number, poison control hotline, like the ASPCA Animal Poison Control Center or Pet Poison Helpline, if applicable in your region. Keep this info in your kit and on your phone. Keep this kit easily accessible, both at home, and consider a smaller version for your car or travel. 2. Recognizing an emergency. When to act fast. Knowing when to administer first aid is as important as knowing how. Watch for these critical signs: difficulty breathing, panting excessively, labored breathing, blue gums, collapse or unconsciousness, non-stop bleeding from a wound, seizures, signs of severe pain, yelping, limping, abnormal posture, hiding, repeated vomiting or diarrhea, especially with blood, disorientation or sudden behavioral changes. If you observe any of these, stay calm, assess the situation, and be ready to act. 3. Common emergencies: cuts and bleeding. Let's start with a common one: cuts and bleeding. Step 1. Control bleeding. Apply direct, firm pressure to the wound using a clean cloth or gauze. Hold the pressure for at least 5 to 10 minutes without peeking. If blood soaks through, add more gauze on top. Don't remove the original layer. Step 2. Assess the wound. Once bleeding slows, gently clean the wound with an antiseptic wipe or saline solution. Remove any visible dirt or debris with tweezers. Step 3. Bandage, if necessary. For minor cuts, a clean bandage might be enough. For deeper or larger wounds, keep applying pressure and get to the vet immediately. Remember, a deep cut or continuous bleeding always requires veterinary attention. 4. Common emergencies. Choking. Choking can be terrifying. Here's what to look for and how to respond. Signs: pawing at the mouth, drooling, difficulty breathing, blue gums, coughing, gagging, panic. Step 1. Check the mouth. If safe, open your pet's mouth and look for the obstruction. If you can see it and it's easy to grasp, try to sweep it out with your fingers. Be careful not to push it further down. Step 2. Abdominal thrusts, modified Heimlich maneuver. For small pets, hold them upside down by their hind legs and shake them gently. For larger pets, stand behind your pet. Place your arms around their abdomen, just behind the rib cage. Make a fist with one hand and cup it with the other. Give 3 to 5 quick, upward thrusts. Step 3. Check again. After thrusts, Check the mouth to see if the object has dislodged. Even if the object is removed, always get your pet to the vet to check for internal injuries. 5. Common emergencies: heat stroke and dehydration. Heat stroke is a life-threatening emergency, especially in hot weather or if a pet is left in a car. Signs: excessive panting, drooling, lethargy, vomiting, wobbly gait, dark red gums, collapse. Immediate action: move your pet to a cooler area immediately. Offer small amounts of water. Apply cool, not ice cold, water to their ears, paws, and groin area. Use a fan to help cool them. Do not submerge them in cold water or use ice, as this can cause shock. Dehydration signs: sunken eyes, dry gums, loss of skin elasticity, skin tinting. Immediate action: offer water. If they won't drink or if severe, they need immediate vet attention for IV fluids. Heat stroke can be fatal. Even if they appear to be recovering, take them to the vet as soon as possible. 6. Common emergencies: poisoning. Pets are curious, and unfortunately, many common household items are toxic to them. Signs: vomiting, diarrhea, lethargy, seizures, tremors, excessive drooling, difficulty breathing, discolored gums, sudden behavioral changes. Immediate action: identify the toxin. If possible, take a sample of the substance, its packaging, or a photo with you to the vet. Call your vet or a pet poison control hotline immediately. Do not wait for symptoms to worsen. Do not induce vomiting unless specifically instructed by a vet or poison control. Some toxins can cause more harm coming back up. Time is critical with poisoning. Act fast and get professional advice. 7. Common emergencies: fractures and sprains. Graphics showing how to gently support a suspected fracture, or hosts demonstrating gentle handling on a stuffed animal limb. Accidents happen, and pets can suffer from fractures or sprains. Signs: lameness, inability to put weight on a limb, swelling, visible deformity, pain when touched. Immediate action: handle with extreme care. Even a normally docile pet can bite when in pain. Consider using a muzzle if necessary. Minimize movement. Try to keep the injured limb as still as possible. You can use a rolled-up magazine or towel as a temporary splint if you know how, but generally, it's safer to just minimize movement. Support and transport. Gently place your pet on a flat surface like a sturdy board or blanket stretcher for transport to the vet. Never try to fix a broken bone yourself. This requires immediate professional veterinary care. 8. When to seek veterinary care and final thoughts. It's vital to remember, first aid is temporary. It's designed to stabilize your pet and buy time until you can reach a veterinarian. Always consult your vet after administering first aid, or if you're unsure about the severity of an injury or illness. Don't hesitate to call your vet or the emergency clinic with any questions, no matter how small they seem. It's always better to be safe than sorry. Being prepared and knowing these essential first aid steps can truly make a difference in your pet's life. Practice staying calm, build that first aid kit, and review these steps periodically. Thank you for watching this crucial episode of Inside Pet Health. We hope you never have to use these tips, but if you do, you'll be ready. If you found this video helpful, please give it a thumbs up, subscribe to our channel for more pet health tips, and share it with other pet owners. And remember, keep your pets healthy and happy.